In a bold and transformative move, the Lagos State government has announced the launch of the Pathway to Malaria Pre-Elimination and Digitization program, an ambitious initiative designed to accelerate malaria elimination through digital innovations, strengthened case management, and enhance public-private partnership. Briefing newsmen in Lagos, the State Commissioner for Health, Professor Akin Abayomi, emphasized that the program is a crucial step towards reducing malaria prevalence to below 1%, marking a significant leap towards disease eradication in Lagos. He explained that despite its relatively low malaria prevalence compared to other states in Nigeria, Lagos still records an estimated 900,000 malaria cases annually, with 4 febrile illnesses presumed to be malaria, contributing to over 50% of general outpatient visits in public health facilities.
Impact Project aims to cut Nigeria's under 5 mortality rate from 107 to 79 per 1,000 live births by the year 2030. Lagos currently has an under 5 mortality of 59 per 1,000 live births, and we'll be looking to achieve an equivalent 25% reduction over the next few years. By accelerating malaria control and strengthening our health platform, Lagos State is aligning with the national and global agenda to enhance child survival and human capital development.
Professor Abayomi disclosed that the program is integrating malaria care into Lagos State's health insurance scheme, Ilera Eco, to ensure affordability and accessibility of the malaria treatment. He urged all residents, healthcare providers, and stakeholders to support and participate in the initiative, emphasizing that malaria elimination is a collective responsibility and the success of the program depends on everyone's involvement. In her remarks, the Special Advisor to the Governor on Health, Dr. Mrs. Kemi Ogunyemi, reinforced the importance of changing public attitudes towards fever management and malaria treatment. She emphasized the role of pharmacists and patent medicine vendors in ensuring compliance with the new malaria testing protocols, urging them to join the government in standardizing malaria case management.
Beyond the toll of health impact, malaria also poses a serious threat to economic productivity. Frequent malaria illnesses lead to missed days at work, at school, reduced productivity, and increases household healthcare costs. Across Africa, where prevalence rates generally range between 10 and 50%, malaria robs the continent of an estimated $12 billion every year in lost productivity, investment, and healthcare costs. Controlling malaria, therefore, is essentially for economic prosperity and the overall strength of the healthcare system.
All of us have had malaria before, and I'm sure most of us were not tested. You just assumed you had malaria because the symptoms were malaria symptoms, but so were COVID symptoms. And so we want to eliminate malaria so you do not have to take malaria drugs if you do not have malaria. So, and like she's also said, it's very important for people to know that, because I know you're probably going to ask how much is it going to cost and all that, but part of that is also encouraging people to take Ilera Eco. Not only do we have Ilera Eco, we also have EcoSha for those who are vulnerable or they cannot even afford it. So it's very important that people register for Ilera Eco or EcoSha, whichever one it is.
Hello, hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.